And I'm delighted to introduce our expert panel. Then Professor Mina Komuta, Professor of Pathology at International University of Health and Welfare, Japan. And we have 4 transplant surgeons, strong panel of transplant surgeons. Professor Toru Ikegami from the Jikei University School of Medicine, Japan. Professor Sudhindran, the president of the Liver Transplant Society of India, and professor of transplant surgery at Amrita Institute of Medical Sciences, Kochi, India. Professor Mureo, Kasahara, National Center for Child Health and Development, Japan, and Professor Kwang-Woong of Seoul National University Hospital, Korea. So we have a very strong panel to take all your questions, and we have had a huge string of questions from everybody, the faculty as well as the attendees. Professor Chen, would you like to start the discussion?
Yes. We have one question from Professor Choi for Professor Egawa. How long you have to maintain the status of depleted peripheral B cell and antibodies after ABOI liver transplant to reduce AMR?
Usually the high risk period is 14 days after transplantation. Usually when we do not have any sign or information or clinical change within 14 days after transplantation, nothing happened. So the rituximab, one dose of rituximab usually maintain the depletion of the B cell at least 3 months, up to 6 months. It is usually enough.